Introduction. Welcome to today's lecture on the pharmacology of triptans. Triptans are a class of medications that have revolutionized the treatment of migraine headaches. In this script, we will delve into the development, pharmacokinetic profiles, efficacy in different types of migraines, the role of 5-HT1 receptors in migraine pathophysiology, triptan-induced vasoconstriction, potential cardiovascular risks, pediatric use, the impact on quality of life, comparison with non-triptan medications, pharmacogenetics, use in menstrually associated migraines, and the comparative effectiveness of different triptan formulations in acute migraine attacks. So without further ado, let's begin. Triptans were developed in response to the need for targeted therapy for migraines. Before their discovery, treatment options for migraines were limited to nonspecific pain relievers such as NSAIDs and opioids. The journey of triptans development began in the 1980s when researchers discovered the role of serotonin, 5-HT, in migraine pathophysiology. This led to the identification of the 5-HT1 receptor subtype as a potential target for therapeutic intervention. Pharmaceutical companies embarked on a mission to develop medications that selectively activated these receptors, leading to the birth of triptans. Triptans exhibit variations in their pharmacokinetic properties, which influence their efficacy and side effect profiles. These medications differ in their bioavailability, half-life, time to peak plasma concentration, and metabolism. Sumatriptan, the first commercially available triptan, has a short half-life and rapid onset of action, making it suitable for acute migraine attacks. Other triptans, such as zolmitriptan and rizatriptan, have longer half-lives, potentially providing an extended duration of action. Triptans have demonstrated efficacy in various types of migraines, including migraine with or without aura and menstrual migraines. The mechanism of action involves the selective activation of 5-HT1 receptors, which leads to vasoconstriction, inhibition of neurogenic inflammation, and reduction in the release of pro-inflammatory neuropeptides. Clinical studies have shown that triptans provide effective relief from migraine symptoms, including headache, nausea, and photophobia. Migraine pathophysiology involves the activation of the trigeminovascular system, leading to cranial vessel dilation, inflammation, and pain. 5-HT1 receptors are located on the endothelial cells of cranial vessels, sensory nerve endings, and trigeminal ganglia. Triptans, by binding to these receptors, cause vasoconstriction and inhibit the release of calcitonin gene-related peptide, CGRP, the principal vasodilator neuropeptide implicated in migraine pathology. Triptan's ability to induce vasoconstriction in cranial blood vessels has been a subject of extensive research. While vasoconstriction is desirable for relieving migraine symptoms, concerns have been raised regarding potential cardiovascular risks. Studies have shown that triptan-induced vasoconstriction is generally well tolerated in individuals without underlying cardiovascular disease. However, caution should be exercised when prescribing triptans to patients with a history of coronary artery disease or uncontrolled hypertension. Due to their vasoconstrictive properties, triptans have been associated with potential cardiovascular risks. This risk is especially relevant to patients with a history of ischemic heart disease or those taking medications that can predispose to coronary vasospasms. It is crucial to consider individual patients' cardiovascular risk factors and select triptans with a lower risk profile when treating migraines. Triptans' efficacy and safety in pediatric migraine have been investigated in recent years. While these medications are generally considered safe and effective in adolescents, careful consideration should be given to their use in younger children. Factors such as patient age, weight, and comorbidities should guide the decision-making process when considering triptan therapy in the pediatric population. Migraines can significantly impact an individual's quality of life, leading to decreased productivity, impaired relationships, and emotional distress. Triptans, by providing rapid relief from migraine symptoms, can greatly improve the quality of life for migraine patients. Studies have shown that triptan therapy leads to reduced headache intensity, decreased rescue medication use, and improved functional ability. Triptans, as targeted migraine-specific medications, have shown superior efficacy compared to non-triptan medications in the treatment of acute migraines. NSAIDs and opioids, commonly used before the advent of triptans, provide nonspecific pain relief without addressing the underlying pathophysiology of migraines. Triptans, by selectively activating 5-HT1 receptors, offer targeted relief from migraine symptoms and have become the go-to choice for acute migraine management. Pharmacogenetics refers to the influence of genetic variations on an individual's response to medications. Genetic polymorphisms in enzymes involved in the metabolism of triptans, such as cytochrome P450 isoforms, can impact their efficacy and safety profiles. Understanding pharmacogenetic factors can aid in personalized medicine approaches for triptan therapy, optimizing treatment outcomes and minimizing adverse effects. Migraines occurring in association with the menstrual cycle, commonly known as menstrually associated migraines, MAM, present a unique challenge in management. Triptans have shown efficacy in relieving MAM symptoms, with some formulations specifically indicated for this indication. Understanding the hormonal fluctuations and treatment options during the menstrual cycle is critical in tailoring therapeutic interventions for MAM. Triptans are available in various formulations, including oral tablets, nasal sprays, subcutaneous injections, and transdermal patches. Each formulation has its unique pharmacokinetic profile, onset of action, and convenience in administration. Comparative studies have evaluated the effectiveness of different formulations in providing rapid relief from acute migraine attacks. The choice of formulation depends on factors such as patient preference, severity of attacks, and associated symptoms. In summary, triptans have greatly enhanced the treatment of migraines by specifically alleviating acute attacks. We have explored multiple aspects including development, effectiveness, vasoconstrictive properties, cardiovascular risks, pediatric use, impact on quality of life, comparison with other medications, pharmacogenetics, menstrually associated migraines, and comparative effectiveness of different formulations. Triptans continue to serve as the preferred method for managing acute migraines and have had a profound impact on the well-being of countless individuals affected by migraines globally.